You're recognized for 5 minutes.
Good morning, Chairman Pitts, Ranking Member Green, and other distinguished members of the committee. Thank you for the opportunity to testify about the Office of Inspector General's efforts to reduce fraud, waste, and abuse, and to promote quality and safety in the Medicaid program. Protecting the integrity of Medicaid takes on a heightened urgency as expenditures and the number of beneficiaries served continues to grow. My testimony today focuses on 3 specific areas of concern that the OIG has identified to be problematic. First, terminated providers continue to participate in bill Medicaid. Second, there are inadequate safeguards for personal care services. And third, the U.S. territories lack Medicaid fraud control units. Prior to the passage of the Affordable Care Act, if a state terminated a provider's participation in its Medicaid program, the provider could potentially participate in another state's Medicaid program, leaving the second state vulnerable to fraud, waste, and abuse. To prevent this, states are now required to terminate a provider's participation if that provider is terminated in another state. The termination has to be for cause, for example, for reasons of fraud, integrity, or quality. Through our work, we found significant problems. Specifically, we determined that not all states submitted data on terminated providers, and that much of the data that was submitted did not relate to providers terminated for cause. We also found 12% of providers terminated in 2011 continued participating in other states' Medicaid programs. To further complicate states' ability to terminate providers, many states do not require providers who participate via managed care to be directly enrolled in Medicaid. If a state is not directly enrolled a provider, it cannot terminate that provider, and it may not even be aware that the provider is participating in its Medicaid program. OIG believes that CMS should, 1, require states to report providers terminated for cause rather than leaving it as voluntary. 2, ensure that the information reported is uniform, accurate, and complete. And 3, require state Medicaid programs to enroll all providers participating in Medicaid managed care. Another problematic area within Medicaid is personal care services. These services allow many elderly people and those with disabilities to remain in their homes rather than being placed in a nursing facility. As more and more state Medicaid programs explore home care options, OIG believes it is critical that adequate safeguards exist to prevent fraud, waste, and abuse in personal care. Through our work, OIG discovered some payments for these services were improper because they were either not provided in accordance with state requirements, not supported by adequate documentation, billed during periods in which the beneficiaries were institutionalized, or provided by attendants that failed to meet state qualifications. Over the years, we have made a number of recommendations to CMS to address Medicaid's deficiencies within the delivery of personal care services, including requiring qualification standards for care attendants be consistent across states, requiring care attendants to be enrolled or registered with the state, and requiring dates, times, and attendance identities to be listed on Medicaid claims. Currently, none of these recommendations have been implemented. Another way the OIG helps protect the integrity of Medicaid is by overseeing the state Medicaid fraud control units. Fraud control units currently operate in 49 states and the District of Columbia, but none are in the 5 U.S. territories. The major barrier to establishing fraud control units in the territories is the nature of Medicaid funding. Unlike Medicaid funding for the states, the territories receive a capped appropriation and routinely use the full amount appropriated. This becomes a disincentive to allocate scarce Medicaid dollars to the establishment and operation of a fraud control unit. Legislation could remove the disincentive. This could be accomplished by exempting unit funding from the capped Medicaid appropriation. OIG believes that such a change would also be cost efficient, specifically in Puerto Rico, which has a total Medicaid enrollment of more than 1 million beneficiaries and is comparable to Medicaid enrollment of many medium-sized states. In conclusion, it is critical that we strengthen oversight to ensure that Medicaid funds are spent appropriately. Thank you for your interest in our work and for the opportunity to appear before you today.